All right, today we're tackling one of the most feared injuries in all of sports, the kind of thing that can literally change an athlete's career in a single second. So let's dive right in. So, you've seen it happen a million times, right? You're watching a game, an athlete makes a sharp cut, they pivot, maybe land from a jump, and boom, they're on the ground. And then you hear about it, that dreaded pop sound coming from their knee. It's a sound that just makes every sports fan wince. Well, that sound? That's almost always the telltale sign of a torn anterior cruciate ligament, or, as we all know it, the ACL. But what is the ACL really? And why is tearing it such a big deal? That's exactly what we're going to unpack in the next few minutes. Okay, so before we can really get into the injury, we've got to understand the ligament itself. Think of it as this unsung hero deep inside your knee. You never ever think about it until it's not there anymore. So what is it? The ACL is basically this really tough band of tissue that connects your thigh bone, that's the femur, to your shin bone, the tibia. It sits right in the middle of your knee, and its number one job is providing stability. It's like the main bridge holding your upper and lower leg together. Here's a really simple way to picture it. Imagine your knee is a car. The ACL, it's the most important seatbelt in that car. It's there to stop any crazy, dangerous movements that could basically cause a total crash inside the joint. And this little seatbelt does a few massive jobs. First, it keeps your shin bone from sliding too far forward. Second, it controls all that twisting and turning. Third, it stops your knee from bending backward, which, yikes. And fourth, and this part is just wild, it's constantly sending little messages to your brain telling it exactly where your knee is. That sense is called proprioception. Pretty amazing, right? Okay, but here's the kicker. Here's what makes an ACL tear so final. Unlike a muscle that's full of blood or a bone that can mend, the ACL has a terrible blood supply. And because of that, it just can't heal on its own. If it tears, it stays torn. That's why this injury is such a game changer. So if this thing is so tough, how in the world does it just snap? Well, it usually happens in one of two ways. You've got your contact injuries. Think of a big football tackle where someone gets hit directly on the knee. But then there's the other way, the one that's way more common. The non-contact injury. This is when you just stop on a dime, pivot too hard, or land awkwardly from a jump. It's your own body's force that does the damage. And get this is the part that surprises most people. A whopping 70% of ACL tears are non-contact. 70%. That means it happens when there's nobody even near you. It's just you and a movement that went sideways. That's why it's a risk in pretty much any sport with running and jumping, not just the big hit ones. So who's most at risk here? Well, the stats show that female athletes unfortunately have higher rates, and that's tied to things like anatomy and hormones. Of course, athletes in sports like football, basketball, and skiing are high on the list. But here's a big one for everyone: fatigue. When your muscles are tired, they can't protect your ligaments, making you way more vulnerable. All right, so the worst has happened. You heard the pop, you're on the ground, what's next? How do you know for sure what just went down? Well, there are some immediate red flags. First, that pop we talked about. Then comes the pain. It's sudden and it's bad. Pretty quickly, usually within a couple of hours, you'll see a lot of swelling. But the real key feeling, the one everyone talks about, is instability. It's this feeling that your knee is just gonna give out, like you can't trust it to hold you up anymore. Now, doctors have a grading system for this. A grade 1 is basically a mild sprain. A grade 2 is a partial tear, so the ligament is stretched out and loose. But a grade 3? That's the big one. That's a complete rupture. The ligament is literally torn in two. And for serious athletes, this is usually what they're dealing with. A doctor can get a pretty good idea just by examining the knee, but to know for sure, you need an MRI. That's the gold standard. It gives them a crystal clear picture of the ligament, and just as important, it lets them check for any other damage, because often you'll tear your meniscus or hurt your cartilage at the exact same time. Okay, so the MRI confirms it. It's a tear. Now the focus completely shifts to the comeback. And let me tell you, it is a long road. This isn't just about healing. It's a full-on reconstruction project. This is a really important thing to understand. Surgeons can't just sew the old ACL back together. Remember that poor blood supply? So they don't repair it, they reconstruct it. They actually take out the torn bits and build a brand new ligament for you, using what's called a graft. That graft is usually a piece of your own hamstring or patellar tendon. But the surgery? That's just day one. The real battle is the rehab.
It's an absolute marathon. The first few weeks are all about getting swelling down and just getting your legs straight again. Then for months, and I mean months, you're working on strengthening and getting control back. A full return to your sport, you're usually looking at 9 months, sometimes even longer. And you're not cleared until you pass a whole battery of tests to prove the knee is ready.
So you can see why the best way to handle an ACL tear is to not tear it in the first place, right? So let's talk about how you can actually try to prevent this. And prevention is so important, not just for your career, but for your life. Because here's the tough truth. Even with a successful surgery, you have a more than 25% greater chance of getting arthritis in that knee down the road. That initial injury leaves a mark.
But the good news is, you can absolutely lower your risk. It's not just about being strong in the gym. It's about training your brain and your muscles to communicate better. We're talking about strengthening key muscles like your hamstrings and glutes, really practicing how to land properly from a jump, and working on your balance and core stability. It's all about making your body smarter.
But the physical side is only half the story. There's a huge mental mountain to climb. Just getting back the confidence to plant that foot and cut hard without that little voice of fear in your head, that is a massive challenge. A lot of athletes will tell you that the mental part is actually the hardest part of the whole thing. So when you really look at it, the whole ACL journey is about so much more than one little ligament. It's a test of everything: your physical toughness, your mental strength, and your trust in your own body. And in the end, the biggest question isn't just, is the knee ready to go? It's, is your mind ready to go? And that's our look at the ACL injury. Thanks so much for tuning in. We'll catch you on the next one.